it's time for some more patient stories.
All right, guys, it's my pleasure to introduce a couple more patients today. First up is a lovely woman who has been involved in the campaign over the last year or so. It's Barton here.
It's true. Apologies for me reading this off a sheet of paper, but if I don't, I'm just going to waffle. So my name's Carly, I'm 32, and my body has been trying to kill me for 10 years. In 2008, in my early 20s, I was taken ill with an autoimmune condition called TTP. It acts a bit like leukemia in that the blood attacks itself. I was bleeding to death, and I spent almost a year living on a chemo ward attached to a machine that would drain all of my blood every day and pump it back in with replacement plasma. This machine and some badass nurses were the only things keeping me alive. Although I pulled through and went into remission, the relapse rate is through the roof and the mortality rate is something I can't even think about. Fast forward a couple of years later, just as I was getting my life back on track, and I suffered a minor stroke, which you can see I've still got neurological tremor from, which is a common occurrence for people with TTP. Despite a fast recovery, I started to get a lot of nerve pain, which increased in intensity, and then followed a crescendo of symptoms, including allodynia, vision problems, insomnia, crippling pain, muscle spasms, mobility issues, and debilitating fatigue. This brought about a diagnosis of fibromyalgia alongside a selection box of other autoimmune conditions. Forward again, 12 months down the line, and I was mostly bedbound with the odd good day a month, and by good day I mean I wasn't in screaming agony. I was in my 20s, and my other half was regularly having to cut up food for me and became my carer. The doctors had put me on 18 pills a day alongside oral morphine and fentanyl. Now, fentanyl is one of the strongest opiates that we use in Western medicine, and to give you some idea of the strength, it's 50 times stronger than street heroin, and he's being held accountable for the opiate crisis that's killing between 40 to 50,000 people a year in the States. Despite the powerful chemicals, I was still in an increasing amount of pain, and to top it off, I was emotionally dulled down by the opiates. I was depressed and I stopped doing everything that I love. This went on for over 5 years, and they were long years. A couple of years back, I randomly smoked a joint to see if it would help me sleep. This was because at the time, I was having to take 5 sleeping tablets, diazepam and morphine to allow my body to rest. After I smoked, I came to bed, and within 10 minutes, I leaned over to my other half and told her that I wasn't in any pain. We were both shocked, and that is the day that my journey with cannabis began. It's taken a year for me to slowly wean off my opiates, and recently I went cold turkey from the final patch of fentanyl. The doctor wanted to put me on a methadone-style treatment program. I refused and did it on 2 paracetamol and a selection of strains of cannabis, which I use in a vaporizer. This was quite a hairy process, but I've been off them completely for 6 weeks now. And I feel more and more myself every day. And the most interesting part about all of this is since I've been off the opiates, my pain is actually much less severe. And that's due to a side effect that they call opiate-induced hyperanalgesia, which basically means opiates can make chronic pain worse. Which is something that I didn't have a clue about when I agreed to try fentanyl in a really desperate state. In an effort to keep myself well, I've experimented with lots of different strains and strengths of cannabis. I require at least 3 different strains to keep my symptoms at bay, and I think that's something that needs to be considered in this process. It's not about saying all cannabis helps, it's more a question of which type of cannabis helps. For me, a 1-strain tincture or oral spray would not be sufficient to manage my encyclopedia of symptoms. The difference between my life on opiates and my life with cannabis could not be more different. In the short time I've been off opiates, I've started making art again, I've stopped my benefits, I'm saving the NHS thousands of pounds a year on my prescription, and alongside some tax-paying work as a lecturer, I've opened up my own little business and spend the rest of my time supporting patients with the UPA. I can often walk without the use of mobility aids, and my family are over the moon to have me back. Opiates are essentially a plaster that can cover up some pain. Cannabis helps my body to heal itself and promotes homeostasis, which brings my body back into balance and calms the overactive nerve symptoms. I've also not had 1 TTP scare or any blood-related drama since I started using cannabis medicinally. I'm a much better person and a more productive citizen because of what cannabis has done for me, and I'm very much looking forward to not being considered a criminal for taking what I would consider to be an essential nutrient that's keeping me well. Thank you.